Hello, welcome to AI Medical School. In the previous video, we discussed the intro of cholinergic drugs. If you miss it out, so go and watch it out, link in the I button. But before we start, if you haven't subscribed to the channel, so subscribe to it and press the bell icon for latest videos. Let's take a quick intro to cholinergic drugs. Acetylcholine stimulate both muscarinic and nicotinic receptors. Methacholine mainly stimulate muscarinic receptors. Carbacholine mainly stimulate muscarinic receptors. But it also have a little nicotinic action. Bothanical mainly stimulate muscarinic receptors. Alkaloids are muscarinic cholinergic drugs which are derived from plants. Alkaloid drugs are Muscarine, Pilocarpine. Now we are discussing agonists drug, which are cholinesterase drugs, so first drug is acetylcholine. Acetylcholine is usually not used pharmacologically because acetylcholine has a very short half-life. When you inject the acetylcholine into the blood, it will be very rapidly destroyed by butyrylcholinesterase, which are present in plasma. Acetylcholine acts diffusely when it injects into the body, and if it reaches the receptors it will stimulate all the cholinergic receptors in our body which we do not want pharmacologically, and due to this reason, acetylcholine doesn't have any pharmacological application. Acetylcholine cannot reach the CNS because acetylcholine is a highly charged compound and it cannot cross the blood-brain barrier. Now the next drug is Bothanical. Bothanical is a cholinergic agonist drug. It stimulates muscarinic receptors on the GIT and urinary bladder. If you want to stimulate a patient GIT or urinary bladder, Bothanical is a good drug. In Bothanical, acetate is replaced by carbamate and acetylcholinesterase, which break down the ester link between acetate and colon. So acetylcholinesterase is not very effective in breaking down the ester link between colon and carbamate, so Bothanical will be slowly destroyed by acetylcholinesterase and butyrylcholinesterase, so Bothanical has a longer duration of action. So what are the contraindications of Bothanical drug? Bothanical should not be given if there is an obstruction to urine outflow. Obstruction like stone or malignant tumor. So if you give Bothanical to such a patient, then the patient will suffer severe pain in the urinary bladder because the bladder will contract strongly and there will be obstruction and urine will not be passed out. Bothanical has been used in postoperative or postpartum non-obstructive urinary retention, neurogenic bladder to promote urination. It can afford symptomatic relief in congenital megacolon and gastroesophageal reflux, but is rarely used for these. Side effects are prominent: belching, colic, involuntary urination or defecation, flushing, sweating, fall in BP, bronchospasm. Its dosage, 10 to 40 mg oral. And its brands are Urotenin, Bethacol 25 mg tablet. The next drug is Carbacol. Carbacol acetate is replaced by carbamate, but there is no methylation. So it stimulates muscarinic receptors and also stimulates nicotinic receptors up to some degree. It has also a longer duration of action. Initially, it stimulates the ganglia and then it inhibits the ganglia in the same way. It stimulates neuromuscular junction and then inhibits neuromuscular junction. It stimulates the GIT and then inhibits the GIT. Uses of Carbacol drug. This drug use for miosis and for contraction of ciliaris. Actually, by these two actions it helps us to lower the intraocular pressure in patient with glaucoma. This drug is only used when pilocarpine is ineffective. Now the next drug is methacholine. Methacholine mainly stimulates muscarinic receptors. That patient in which we suspect hyperreactive bronchial constriction of bronchial hyperactivity. The bronchial hyperactivity means that if the bronchial tree is a little bit irritated, bronchial tree contraction occurs or bronchial spasticity occurs. So if we have to diagnose a patient with asthma, and if we are not sure that he is having asthma or not, then we check his bronchial hyperactivity. We give a little inhalation of methacholine which will produce very little bronchoconstriction in a normal person, but that amount of methacholine will produce strong bronchoconstriction in a patient with hyperactive bronchial tree, and before doing this test you should have a bronchodilator. The last drug of Agnoist Cholinergic drug. Pilocarpine. Pilocarpine is tertiary amine and pilocarpine is stable with acetylcholinesterase. Stability means that pilocarpine is not easily destroyed by acetylcholinesterase, so its half-life is long. Pilocarpine is derived from plants. Its alkaloid. Pilocarpine mainly stimulate muscarinic receptors. Pilocarpine is used only in the eye as 0.5 to 4% drops. It is a third-line drug in open-angle glaucoma. An initial stinging sensation in the eye and painful spasm of accommodation are frequent side effects. Other uses as a miotic are to counteract mydriatics after they have been used for testing refraction and to prevent or break adhesions of the iris with lens or cornea by alternating it with mydriatics. Though it can be used as a sialagogue, no oral preparation is available. And its brands are Pilocar 1%, 2%, 4% eye drops, Carbine 0.5% eye drops, Pilodrops 2% eye drops. That's it for now. I hope you liked the video. If you found this video helpful, so subscribe to the channel. Thanks.